Hello everybody and hello everyone, and welcome you on today's webinar. And it's very, very special to me personally, and because of many reasons. One of these reasons are very special, and it's the number of people participating today. And it's really incredible to see how many people are interested in African issues. But honestly, I'm not surprised, because this today webinar was inspired by session what we did with these speakers, with today's speakers in Lisbon. And it's not secret that organizers expected just very little number of people there, but at the end people were not able to sit because we didn't have enough chairs. So the same situation is today, and it's repeated, history is repeated. And I would like to welcome you, and the issue related to African situation, African universities and training programs for addiction workforce is something what is, I think, and I think that many people are slightly underestimating these issues, but in fact there are many things what are happening there, and the history is not maybe so long, but you can see today very proud journal, African Journal of Drug and Alcohol Studies. You can see many university teams and training institutes developing, testing, and providing very nice program. And today I have it's great honor, and I have this honor to introduce you with three speakers who are truly leaders in this region, and they will introduce you with their teams, with their work. First speaker is Beatrice Kathungu, lecturer from Department of Psychology from Kenyatta University in Nairobi. And before her speech, I would like to express my special thanks towards ICUDDR and International Society of Substance Use Professionals and three of my colleagues, Radolf Notway, Olivia Woodrow, and Kerry Hopkins, for organizing and supporting today's session. So enjoy it. And Beatrice, if you can prepare your first presentation and introduce us with the situation on African continent from the general perspective, and especially with special focus on your own work and your team in Nairobi. Thank you.
Thank you, Professor Mikal. I hope you can hear me. Please confirm that you can hear me.
We can hear you perfectly. Thank you.
Very well. Thank you very much. So thank you, Professor Mikal, for this opportunity to share what we are doing in Africa. I want to express gratitude to ICUDDR and ISSUP for the thought of putting together this webinar to give us an opportunity from Africa, ICUDDR, to share what it is that we are doing in our continent. And I acknowledge the support that we have received from the different organizations. I work at Kenyatta University in the Department of Psychology, but I also coordinate the leadership of ICUDDR in Africa, and I'm happy to have two of the leaders with me here, Martin and Rihanna. And so I'm going to be sharing with you a journey that we have walked as a continent in our zeal to develop the addiction workforce in Africa, in the realization that we cannot overcome or we cannot succeed in the work against drug demand reduction, in the work towards preventing drug abuse, if we do not develop the workforce, if we do not professionalize the field. And so I'm going to be sharing with you how we have piloted what we call an implementation protocol and how we delivered it through the COVID times and where we are right now as a continent. Of course, our desire to be involved in these activities was informed by what is happening at the global level, at the regional level, and even in our local countries and our specific universities. I think we are aware of the statistics around drugs and drug use disorders worldwide, and the increase in the last decade that makes us very keen to do something about the problem. We know that a good number of the people that are injecting drugs will suffer from hepatitis C and other blood-borne diseases. and some will even suffer from both conditions. And that means that for countries in Africa where the burden of disease and the resource is high and the resources are constrained, then the problem gets very complicated. And that then means that we need to be concerned coming from Africa. Now, Africa is a vast continent. For those of us who may not know well, we are over 50 countries. We are over 1.3 billion people. We stretch all the way from the Indian Ocean to the Atlantic Ocean, which also then means that there is a high risk not only of drugs being produced in the continent, but also being trafficked across, via the continent. UNODC reports have emphasized the problem of drug use in Africa. Reports have indicated that as much as 40% of people have used or will have used drugs by 2030, because we have younger populations, we have a big population growth, and majority of these people may not be treated. And many of them are actually under 35 years old, meaning that they are productive citizens of their countries. And therefore, unless we make an intervention very, very seriously, we are likely to have a big negative impact in Africa. And therefore, we as universities in Africa have risen to the calling, and we want to be part of the narrative that tries to address the problem in terms of prevention, in terms of treatment, in terms of recovery support, and other public health interventions, including influencing policies in our own countries and in our regions. Now, a good number of the things that happen in Africa is that we do have efforts at addressing the problem of drugs and drug use disorders. But a good part of what has been happening is that we don't have a lot of evidence generation. And so what we do may not necessarily be backed by evidence. And as a result of this, there's a lot of stigmatization of people who have substance use disorders. We have a lot of sometimes discrimination, and patients are seen as just simply lacking willingness to change because of limited understanding of the problem of substance use disorder. And therefore, we have limited opportunities for interventions. And because of this, then a couple of things we are witnessing in our countries, where you have got frustrated clients and their families, where you have failed prevention and treatment efforts because of use of non-evidence-based methods and practices, resulting in wasted resources for individuals, families, communities, and countries. And a good bunch of people have generally just lost faith in interventions that are being put in place for substance use disorders. Now, even insurance, coverage for health is afraid of covering conditions related to substance use disorders because of lack of faith in the interventions that we have. And as a result of all these, then we have poor client outcomes. And because of this, then we have seen a need as universities in Africa to address the whole idea of how to make sure that there is access to evidence-based interventions in Africa. And we do appreciate that there is a lot of literature that does tell us that we need to offer continuum of prevention. We need to offer appropriate and timely screening, assessment and placement. We do need holistic treatment, and we do need support for long-term recovery, as well as, evidences that are supporting policies in our countries. We do believe as universities in Africa that if we do this, we will have better outcomes for our clients. We will have reduction in wasted resources. We will have increase in faith or increased faith in treatment for substance use disorders and the prevention interventions we put in place. And we are therefore likely to attract more stakeholders to support, clients, whether with regard to prevention, with regard to treatment, and even recovery support. We do acknowledge that a lot of work has been put in place by the INL through the different interventions. So we want to thank the US State Department for the partnership with Colombo Plan, for the partnership with ISSUP and ICUDDR to ensure that some efforts are happening at a global level and trickling down to our regions and our countries. We noticed that a lot of this is targeting a wide range of professionals in the field of SUD and ranging all the way from prevention, treatment, recovery support. A good number of our countries have been able to actually benefit from the universal prevention curriculum, the universal treatment curriculum, and even the recovery curriculum, as well as the special curricula like the women and the child curricula that have been developed, and we appreciate that. However, we do notice that these efforts on their own may not help achieve our desire to have a continent where we are practicing evidence-based practices. And therefore, we think of universities as the niche that we need to take advantage of so that we can do much more and in a sustainable way. And therefore, by tapping into what is already existing in universities, there's much more we can achieve as stakeholders. And one of the reasons why we advocate for universities' involvement is that we do know that universities' core mandate is education and training. Within universities, we already have quality mechanisms of quality education, monitoring, evaluation. We already have existing resources, whether it's the infrastructure in terms of lecture halls, ICT and learning management systems, the faculty, which have a certain level of capacity that just requires upscaling. And therefore, we could actually take or tap into this to be able to make a difference. And therefore, through ICUDDR, we are picking what we are calling a sustainability strategy. We are thinking that universities can offer a more sustainable way for disseminating evidence-based practices and evidence-based knowledge, so that when we finally look at our countries, we can see a difference. We can see people practicing with evidence, with knowledge, with skills, with competencies, and that can then translate into improved outcomes. And therefore, as universities, we are committed with support from ICUDDR to make this evidence-based knowledge available and accessible. And this we do by developing and implementing what we are calling academic university-based drug demand reduction programs, or sometimes we call them addiction science programs. And these ones can target both people already in the field as practitioners, and we offer that as continuing education, and it can also be pre-service education to potential practitioners that may come to the field of DDR or allied disciplines that are already offering programs. Now, we're doing this through ICUDDR, and we have acknowledged that ICUDDR plays a very important role in promoting the transfer and adaptation of this knowledge into programs within universities. And they have supported the adaptation of UTCs and UPCs into university-based academic programs. And I want to share a little about our model in Africa. So after putting in place several strategies, we have been able to consolidate these strategies into what we are seeing as a sustainable approach for Africa. And it has got 6 steps. The first step is that we identify what we call strategic university faculty. Now, a strategic university faculty is a person that's willing to become a champion, a person that has passion for making a difference in the field of drug demand reduction. And once we have identified this faculty, we put them together and conduct what we call a walkthrough. Now, the walkthrough is a capacity building, which is supposed to make them familiar with the UPCs, the UTCs, with a view to helping them begin to think about how this can be adapted into a program that can be offered in a university. Now, once we do that, in the third step, we do what we call a needs assessment for program development. In the needs assessment for program development, we are focusing on assessing the capacity of this faculty to develop programs. They may have the knowledge of the evidence-based practices and competencies and skills. They may have the knowledge about UPC and UTC, but we now want them to be able to translate that into a university program. And we do know that university programs are rigorous. There's a lot of threshold that must be met in terms of approvals, in terms of meeting requirements of the institutions, of the regulators, and even sometimes of specific bodies that work in those countries. And therefore, we do a needs assessment, and we already have a tool in place that we are using. And then in the fourth step, we do the actual capacity building for program development. Now, this again, we have been able to do, and I'll be talking about that, what we have been able to do in that area. And then the next stage, we do the actual development and implementation of programs. And as ICUDDR, we are actually supporting universities that are interested in developing the programs, and we're giving them technical support. We are benchmarking, we are sharing knowledge and information. And at the 6th stage then, we actually want to take it a step higher. having developed programs, having implemented programs, we want to check the impact of these programs on practice. How are they translating, or how is this training translating into improved outcomes, whether it's in prevention, whether it's in treatment, whether it is in recovery support and related areas. So that is our model. And so I now would like to just share a little of what we have done. We have already been able to do, we held what we called a catalytic meeting in Addis Ababa. And the purpose of this meeting was to put together the members or potential members of ICUDDR to be able to come up with a leadership structure. And that leadership structure is made up of the regional leaders, the leaders of the continent, chaired by myself. I have a vice that's called Martin and is in the house. We have a secretary that's Rihanna in the house. And this leadership steers the continent through a lower level of leadership at the various regions from the West, the East, the North, and the South. And that has helped us to achieve a lot in terms of this goal. And therefore, what I'm really trying to say is, if we want to achieve in terms of being part of building capacity, being developing programs, we have to think about the leadership of the regions. And through this leadership, we were able to organize a walkthrough for universities in Africa. We have also been able to do a continental needs assessment of many universities across the continent. And part of this helped us to see what were the gaps that needed to be addressed. And these were some of the needs that came out. Many of them wanted to know, how do you even decide on an academic program? How do you do a needs assessment to develop that program? And I'm happy that one of our presenters today, Dr. Rihanna, will actually be addressing their experience on how to empower universities to conduct a needs assessment. They also said they wanted to know, how do you ensure your program meets university requirements? How do you determine the level of the program? Is it an undergraduate? Is it a postgraduate? They also wanted to know, how do you mobilize resources? How do you then develop the courses that are relevant and meet the needs that have been identified? How do you monitor and evaluate academic programs? So this came out as, what are the needs that we needed in African universities to be able to develop academic programs. And as a result of that, it was important to develop a course whose purpose was to build the capacity of the faculty to develop academic programs. Of course, it's anchored on the identified needs. It has been developed with support from ICUDDR, and we're very thankful for that. And this is a rich course that has got 7 modules. Now, the modular approach allows a faculty or a group of faculty from one university or many universities to select, based on their needs, what module they want to cover. Now, these modules are addressing each and every one of the needs that was identified from the needs assessment. So module 1, for example, looks at how do you gather input from potential stakeholders of your program to develop an academic program, a DDR-related academic program. The second module looks at how we develop the goals of a program, the objectives of a program, and how we align them to the goals and objectives of the university. The third module looks at how we can determine the academic program nature. So are we going to roll out or develop a prevention-based? Is it a treatment-based, or is it a combination of both? Who will be our target population? At what level shall we pitch that program? So that's what the third module addresses. The fourth module is what we call the real cooking. It addresses information on how to construct the actual courses and how to ensure that the courses that you construct are aligned to the program learning outcomes, which are aligned to the needs of the target population. In the fifth module, we look at how we ensure that the program we have developed is aligned to the university requirements. A lot of universities have requirements for programs. Sometimes we have professional bodies that regulate the programs in their countries. They have their requirements. Sometimes we have got what we call the national bodies that regulate education. They have their requirements. So module 5 helps faculty to understand how to align their DDR academic program to all these requirements. The sixth module addresses a critical issue of how do we mobilize resources to support academic program development, whether it is human resource, financial resources, infrastructure, and many others, technical expertise. That's what that module is about. And finally, the 7th module looks at how we monitor and evaluate academic programs. So that is our course that is available, and it is available online. And we had the privilege of piloting this course. It was actually supposed to be a face-to-face, but due to COVID, it was done online. And we are happy to say that during that training, or that pilot training, we had trainer-led presentations, we had practical group assignments, we had collaborative learning, we had a lot of feedback from the trainers and the peers. We used a learning management system called Health Knowledge, and that helped us to increase access to this course. We used many platforms besides the LMS. We had WebEx, we had emails, we had WhatsApp as communication, we had Google Drive, and all this meant that we had a lot of flexibility when we were trying to roll out that course. We delivered it weekly, 2 hours per week, and it was often done in the evening to accommodate the faculty work schedules, which are really busy. Initially, we thought we'd go for 53 hours, but it actually stretched for 70 hours, which ended up being 35 weeks. That was quite a long haul. And it was very attractive to participants because of the flexibility, the practical nature of the material, and that they could get certified after each module and also at the end of the whole course if they covered the whole course. Now, because of that, we have made several achievements. About 6 countries completed this training. Many have started using the material, the rich experiences that they gained, and they are adapting that knowledge to their unique contexts. These are some of the countries that we reached. Like you can see from this map, we had South Africa, we had Botswana, Malawi, we had Uganda, we had Nigeria, we had Kenya. Some of the challenges we faced, of course, I've talked about the long haul. We've talked about the busy schedules of the faculty. A few dropped out. Completing assignments in virtual space was a challenge, but we learned many lessons. Perhaps the need to cluster the modules and do intensive training, and people can take breaks in between. Of course, we learned the value of collaborative learning. What are we thinking about going forward? We are now reviewing the modules based on the pilot feedback, and this should be completed by May 2023. We are rolling out that course to more faculty that are interested in Africa and beyond. This should happen this year before September 2023. And we are also beginning to start evaluating the impact of the course, whether it's immediate or long-term in terms of development of the academic programs. We also want to scale up capacity building for more faculty, and we want to support rollout of programs by individual countries and individual universities, as we also begin to sensitize universities and countries to invest more in the drug demand reduction related programs. I wish in a very special way to acknowledge our partners. I have mentioned ICUDDR, INL, ISSUP, Colombo Planned Up, the regional leaders, the African Union, the individual countries and their participants, including the universities, and the African coordinating team of leaders. It is because of their contribution that we have been able to make these great strides. I do recognize that if we continue collaborating together, we can achieve much more. I thank you for listening to me.
Thank you, Beatrice, for your excellent first presentation for today. And I see first comments and questions, but we will have a joint discussion at the end of our today's session. So we will proceed to the second speaker, Martin Agbovi, founder and executive director from Global Initiative on Substance Abuse, GISAE, from Lagos, Nigeria, and he will speak about addiction curricula in Nigeria. And I can say that it was pretty nice work with Nigerian colleagues, and they were very enthusiastic and highly motivated in taking information about new curricula and in trainings. I was always very happy to work with all of them. So Martin, if you can prepare your presentation and we can start with your time, and microphone is yours.
Thank you so much, Mikhail. for that wonderful introduction. Please confirm if you can see my slide. Please, can you see my slide?
Not yet. Yes. Yes. Yeah, we can see it.
Oh, good. So once again, thank you, Mika, for moderating this webinar, and thanks to all the attendees for being here. Briefly, I will be speaking on addiction curriculum in Nigerian higher education system, contextualizing Western-based methods and approaches for responsiveness and effectiveness. Nigeria is the most populous country in Africa and 7th in the world. It's a country that the youth and the children population is, of course, the youth and children population in Nigeria is one of the highest in the world. So about 70% of the population is below the age of 30. So it's one of the countries in the world with the largest youth and children population. And of course, there is a burden of drug use and drug use disorders with above 14% drug use prevalence among the adult population, and almost 3 times the global prevalence. And despite this high burden of substance use disorders, access to treatment is low compared to needs. And one of the reasons for the low treatment rate is because of limited workforce. And this is also complicated by the brain drain. So health and social welfare training programs often do not include specialized training in substance use disorders, and coupled with lack of certified courses in addition, as well as credentialing process. This, of course, is of nationwide systemic concern. So, and one of the ways to address these concerns is building health workforce and strengthening the available human resources through capacity building, through a range of menu of courses for competency-based multidisciplinary roles in addiction science. It also involved contextualizing Western-based models of pedagogy in order to develop addiction study curriculum that is sensitive and, of course, responsive to both local and national needs. It is against this background and rationale that this presentation highlights a co-produced curriculum for addiction studies in Nigerian higher education system. Prior to the introduction of ICUDDR to Nigeria, there have been efforts by both local and international organizations to conduct trainings in substance use prevention, treatment, and recovery. This basically were through government and non-governmental organizations and so on. And those who attempted to address or to overcome the knowledge gaps and skills in addiction science attended these trainings, which in most cases were occasional and unsystematic. No university offered addiction studies, except for some universities who offer topics in courses like social sciences and medicine. Similarly, there were no guidelines on competencies, and mostly rely severally on internationally accredited curricula that in most cases lacked contextualization. So some of these interventions also were at the early stage and with a limited evaluation. But Through the introduction of ISSUP and ICUDDR to Nigeria, and of course with increased membership and interest of drug demand reduction practitioners in Nigeria, this exposed practitioners to international knowledge on evidence-based service delivery. This also increased the involvement and interest of universities in Nigeria in developing academic programs in addiction studies. Just like I said, prior to, like I said earlier, prior to 2018, when ICUDDR was introduced to Nigeria, no academic program, whether at the diploma level or at the postgraduate level, were offered in Nigeria universities. But as of today, as I speak with you, 2 universities in Nigeria offer addiction studies at postgraduate levels. As we may all know too, central to workforce development is curriculum. And what we did in developing this blueprint for Nigeria was to review different courses relating to the field of addiction science. And we also reviewed the UPC and UTC curricula. And of course, we did in-depth interviews through focus group discussions among stakeholders in Nigeria. So this process created awareness about the need to contextualize Western inputs and local realities, and of course, establish a theory-driven process for identifying barriers and opportunities that may arise in the course of developing addiction curriculum in Nigeria. And of this provided an overview, based on the collaborative collaboration that is expected in the field of addiction, and also partnering with institutions. And of course, this was developed in collaboration with the ICUDDR and in accordance with the Bologna Declaration. Other materials or curriculum models that we reviewed includes the subject-based model, the expressive model, the problem-based model, objective model, as well as the humanistic educative approach. But after reviewing all of these models, looking at the merits and the demerits, none of them was wholly selected or adapted. We also reviewed the 6 major areas covered in the WHO health system building block, which include health workforce, health information systems, health service delivery, access to essential medicines, health systems, financing, as well as leadership and governance. But after reviewing these areas of building blocks, we discovered that strengthening the health workforce will help in addressing the drug and substance use challenge in Nigeria. So this includes building capacity, that is improving the human resources through evidence-based substance use legislation, or that will promote evidence-based substance use legislation and policies. Also, pre-service training curriculum, in-service training with locally contextualized tools, then continuing in-service training and mentorship, and of course, capacity building for mentoring and evaluation, as well as linkages with international partners, which of course is very important. What were our priorities? Our priorities were to develop competency-based roles with continuing education and transitioning to addiction specialists. This also includes multi-professional course that will lead to widely accepted national certification in substance use prevention and treatment that is also appropriate for professions with regulatory bodies through collaboration. So we also looked at the studies program that will undoubtedly have an immense impact on the professionalization of the Nigerian addiction workforce. Then last but not the least here is to have a more coordinated response to the drug menace in Nigeria. Then among the priorities still is to develop structural mechanisms, to support universities in different areas such as specialized journals, research centers, education programs, training, professional societies, and of course, building a strong institution for the profession. The team that developed this curriculum are experts from universities in 4 out of the 6 geopolitical zones in Nigeria and an NGO. These experts developed or formulated the aims and learning outcomes of a competence-based curriculum and in line with the Beatrice model. So the team used mapping, of key educational program in line with the concepts required to meet the aims and objectives. And it also included the IMPG model. This was put into consideration too. Then talking about the Beatrice model, what does this entail? It is an approach that creates an environment that promotes creativity, reflective learning, critical thinking, interpersonal relationship, as well as attitude change through process learning. It is also a model that encourages interaction process around the curriculum content rather than the content itself. And it also facilitates interdisciplinary collaboration. And it is a holistic framework that puts into consideration cultural issues, different stakeholders, and also considering recovery capital, especially in the area of treatment. The key steps in Beatrice model briefly include drawing up a map of key subjects, compiling a schedule of basic skills needed, assembling a portfolio of meaningful experiences to guide learning, and of course, constructing an agenda of important cultural issues. So all these were done through key stakeholder analysis and of course through in-depth interview. Talking about the cultural considerations, which of course is very important in curriculum development, we also looked at the UPC and UTC to identify cultural gaps to expect when incorporating them in our new curriculums. And I must say that this step highlighted the promise of improving curricular quality and adoption rates. So in considering culture, looking at the cultural issues, our focus was mainly on social, ethical, and political issues, also not overlooking the aspect of a long-term disagreement that exists around the topic of health, which is not peculiar to Nigeria. Experts have different perceptions and approach to health-related issues. In terms of knowledge and skills needed, we felt that in this field, at the higher education level, students should have sound knowledge of pharmacology, epidemiology, medicine, public health, health education and prevention, health psychology, social policy and context, treatment issues, and of course, legal aspect, which of course is peculiar from one country to the other. So we also identified 3 levels of courses, which we broke down into 3. That is the basic, intermediate, and advanced level courses. For the basic level courses, we identified physiology and pharmacology of drugs, the continuum of care, among others. And at the master's and PhD level, we also looked at similar courses, but at in-depth level. And we included courses that deals with special population groups, as well as trauma-informed care. So at each of these levels, diploma, master's, and PhD, the core competencies will be graded and in different in scaffolds, such as analytic assessment, cultural competency skills, management skills, policy development skills, and of course, basic public health skills in SUD. Again, we cannot overemphasize the importance of cultural competency in this. So at the end, students will need to achieve competencies in each domain at one of the three levels, which of course we said are awareness, knowledge, and proficiency. The awareness level we term as more of a generic. At the knowledge level, the learner has an intermediate level of mastery of the competency. Then at the proficiency level, the learner can synthesize, critique, or teach the skill. So at each of these levels, we feel the generalist role will be more of at the diploma level, a specialist manager role at master's level, and the consultant role at a PhD level. Duration of programs, we recommended that at the basic level, it should be 1,500 hours. At the master's level, full-time 3,000 hours, and at the PhD level, full-time 6,400 hours. We were also sensitive to peculiarities in different disciplines, such as medicine, psychology, nursing, pharmacy, and social work. So we feel that the addiction field is not to overshadow any of this field, but it is important that the theory or the foundational theory of all these disciplines should be respected, more so that all courses are developed through a system or ecological perspective and the adoption of a strength perspective. We also consider the students' lived experience, which is very important because we're talking about adults here. Their interests, experiences, and needs are very important in developing a curriculum. We feel that this is very important as part of a review. As we may all know too, a curriculum seems not to be adequate without provision for evaluation. So we felt the CIPP model, which of course is well recognized, is worthwhile when it comes to evaluation for this curriculum. We also felt that there was no need to reinvent the wheel, as different models have been proposed before now, looking at the Herrick and colleagues model, as well as the Chavert and colleagues model. So all of these models have been looked into and followed in the course of developing this curriculum without reinventing the wheel. So within this perspective, as I begin to round up, a continuum of 3 levels of higher education of addiction studies will provide the key to building the requisite trust for successful learning, mobility, cross-boundary academic cooperation, and forum for international dialogue. And of course, we envision that a continuum of service, that is accessible to a broad range of stakeholders will stimulate expansion of competent addiction workforce in Nigeria. And we also believe that through this model, we will be able to professionalize the field of addiction science in Nigeria. And of course, development of curriculum does not just end there, or graduating with degrees in addiction does not end there if there are no employment opportunities. This we have also found to be available in Nigeria, both at the government, private, and NGO levels. Well, there are still bridges to cross, and one of which is limited support and buy-ins from academic and government institutions, issues relating to regulatory and accreditation bodies, collaborative relationships across agencies, limited investment in the training by government bodies, then the capacity for supervision, and of course, differences in practice, in work setting and training environment. And the last but not the least here, funding, which of course is really very important. So in conclusion, I would say the fact that the addiction science has not been developed as a university program in Nigeria before now also reflects the low estimation of addiction science as a strategy for addressing the burden of drug use in Nigeria. This milestone, and that is the development of this blueprint, in collaboration with ICUDDR and in accordance with the Bologna Declaration, is a step in the right direction. And we hope that other countries and partners who are interested in this model can also key into what we have done. And before I say thank you, let me quickly acknowledge my colleagues with whom we work together to develop this curriculum. Thank you for your attention.
Thanks so much, Martin, for your very nice overview of what is happening now in Nigeria. And it's, as I said before, it's really impressive how big this group is and how many universities are responding positively to this call. And for those of you today who are interested in African programs and what universities are operating, what and where, it's 3 years ago when we published analysis of African universities and college which operating, really operating today existing programs on African continent, and it was published in Substance Use journal edited by Professor Richard Pates, who is in cooperation with many of you, and this analysis of existing programs is available, and I think that it can be pretty useful for those of you who are interested or thinking about future programs. So thanks so much again, Martin, for your presentation, and we will proceed to our third speaker, who is Rehana Kader. Thanks. From Life Vincent Pallotti Hospital and Randebosch Medical Center in Cape Town in South Africa. And Rehana will speak about needs assessment and preparatory work for addiction science programs. And I can say a couple of words about it because it was more than 10 years ago when I've read for the first time their very nice first papers about evaluations of some first training programs, and I was really excited and impressed that it's so highly professional and very nice methodology. And I think that this third presentation will be also very nice and interesting because I always is impressed that professionality of your work is pretty nice and completely comparable to European universities or South American universities. So Rehana, space is yours, microphone, and you can start with your presentation.
Okay, thank you, Prof. Michael, for the introduction. I will now share my screen. Right, so today my presentation will focus on a needs assessment that was conducted in South African universities, looking at what are their curriculum needs. So Beatrice and Martin, my colleagues, have done a great presentation in giving you an understanding of what the overall context of the continent is and the need for an addiction curriculum, as well as for a professionalized workforce. In her, excuse me, I have a bit of a flu. In her presentation, Beatrice gave you a framework of the different steps in terms of wanting to implement an addictions program. And I'm happy to say that we've just currently completed the third step. So Beatrice mentioned the first step was identifying universities in your country, which we did. Then is to conduct a walkthrough training with your staff from the different universities, and this South Africa has completed. And the third step was to do a needs assessment to find out what are the particular needs. And that is what I'm going to talk to you about that we've done in South Africa. So as indicated by my previous colleagues, any curriculum development, it's a process, and one needs to start with a needs assessment because it's important for us to know what are the particular needs of universities. We cannot just assume and impose a curriculum on them. So hence, I'm going to give you an overview of the methodology we used, the results we've got, and some of the recommendations in terms of how we go on to the fourth stage is where we start implementing the program. Research conducted in South Africa, and what I've heard from Beatrice and Martin again in the continent, is that treatment rate remains low, although all our countries have a high prevalence of substance use. And the reason, or the question was asked, why is treatment rates so low if we have such a high prevalence of substance use? And the explanation that we found out or from research was that this was due to a lack of expertise among professionals in substance use disorders. And this was quite a problem for our country because the health professionals, and I'm particularly talking about doctors and psychologists and psychiatrists in South Africa, are trained very generically in substance use disorders. So there isn't a speciality as such. So as Beatrice indicated and Martin, what better way to start professionalizing the workforce but to start with the universities, because this is where we train people to become professionals in their field. And I think this is in line with the mission of ICUDDR, where we want to ensure a professionalized workforce so that we effectively and competently provide the best treatment possible for people with substance use disorders and related conditions. So the brainchild of ICUDDR was Professor Mikhail Majewski and was founded in 2016. And the African continent started their chapter in 2019. Our country's specific objective was to do a needs assessment, which would inform implementation of a program. So what was the objectives for us to do the needs assessment? We wanted to know what's the current landscape in the country regarding addictions program. What we wanted to know was the perceptions of the academics in terms of them implementing a new specialized addictions science program. Would they be keen? And we also wanted to get a sense of whether they would be keen for certification of transdisciplinary professionals. So not only looking at healthcare professionals, but looking across the board. And whether it is feasible, do we need a UTC curriculum? Do we need a UPC curriculum? So these are some of the questions that we wanted answered so that we know what would be the next steps. The methodology that we used was a purposive sampling. If you look at my screen, you'll see that that's a map of South Africa, and we have 9 provinces. And in each province, we have 1 university, up to 3 universities, up to 5 universities. So in the country, we have a total of 25 public universities. And of this, only 19 offers behavioral health sciences courses or programs. And the needs assessment that we conducted, the response that we received was 17 out of these 19 universities, which is phenomenal for an online survey that only 2 universities didn't respond. So we were quite excited that the response indicated to us that universities are keen and are interested in an addiction science program. How did we collect the data? We used a structured 33-item electronic survey, which was emailed to respondents. Aside from emailing it to respondents, we picked up the phone, we called them, we sent follow-up emails, we developed a very personal relationship with these universities. And hence, I think we had such a high response rate, because just sending off a survey, your response rate is very low. So the importance of relationships was highlighted in the work that we did. And we used the implementation guide that was developed by ICUDDR, and it's on the website, which if you are keen on, you could go to the website and look at the implementation guide, which is extremely useful if you are thinking about implementing substance abuse curriculum at your university. So I just want to give you an example of some of the questions that we asked in the survey. We asked, do you know if your university offers any addiction science programs? And what kind of programs? Is it course? Is it a module? Is it a degree? Is it a diploma? And then we also asked, what would be your objectives for wanting to consider such an addiction science program? Okay. We also wanted to know, what do you think are some of the challenges and the gaps, and how do we overcome this? And importantly, we wanted to know, does your university have the capacity and do you have people to teach an addiction science program? Yes, so I'm not going to go through the entire questionnaire. I'll just go through the last two or the last three. We asked them, if external resources are offered by ICUDDR, would you be keen to receive these resources and help? And we also asked them, would they be willing to utilize the UTC and the UPC curriculum? We had an overwhelming response with 37 responses from people, and this is across departments because we did it transdisciplinary. So although 17 universities responded, but of that 17 universities, we had different faculties. So we had the medical faculty, we had the psychiatry faculty, we had the nursing faculty. Because we want to do a transdisciplinary, different faculties were involved in this needs survey. And as you can see, that the overwhelming response, or the majority of response, was from the psychology department, where they offered some sort of training in addiction science, which I think is not unusual. As psychologists, we are trained in some form of counseling and skills in addiction science. When we ask universities, what are the current forms of addiction science programs? Most universities offer a very short course or a module or a seminar. However, we have two universities in South Africa, and they're based in the city that I live in, Cape Town, which is the University of Cape Town and the University of Stellenbosch, where they have a very, very specialized postgraduate diploma in addictions. And that's only two universities out of the 25 public universities. So what are some of the gaps and challenges that our universities experience? Not surprisingly, we don't have enough qualified academics, as explained before. We don't have sufficient training opportunities in the country. Substance use is not a core teaching focus. And I think a very huge stumbling block, and I don't think this is unique to my country, I think it's overall in the continent, but in other countries as well, that whatever program we offer in addiction science does not lead to accreditation. And if we want to professionalize addiction science, it has to be recognized as a profession in its own right. And I spoke about professionals being generically trained. In terms of capacity, again, if they have registered psychologists, then there is some capacity. However, universities have full workloads. They have some capacity to implement modules, but not an entire program. Again, short-staffed, and resources. No budget. Finances is always a challenge for all universities. We need to upskill our trained staff, but there is a keen interest in the program that we want to offer. I think this was very interesting when we asked them if they are willing to implement an addiction science program. And 95% of the university said, yes, we're ready and willing to go with the ICUDDR program of implementing a addiction science curriculum. And I think this was very, very encouraging for us as ICUDDR. Some of the objectives was that they want to develop a standalone program, and majority indicated that they would want to start off with short courses because they don't have the capacity. They want to provide an overview of addictions And more importantly, we want to look at the standardized curriculum across the country. So we are all doing evidence-based practice science in terms of our treatment. Let's see, time is running out, so I'll go very quickly. In terms of our cooperation, university said they would like ICUDDR to help them in building and improving the existing curriculum, to enhance staff teaching capabilities, and to enhance international collaboration with other universities in the world. Majority indicated that they would benefit from both the UTC and the UPC that's offered by ICUDDR. So we asked them who would be the potential candidates. And I don't think it's a surprise that the majority indicated that the first priority will be upskilling the existing professionals, because this would then cascade into the professionals teaching the postgraduates and undergraduate students in addiction science. Core competencies that they wanted was screening and assessment tools, theories of addiction, evidence-based counseling, and understanding substance use in terms of co-occurring disorders. So in conclusion, yes, there's definitely a need for an addiction science program. The climate is right in our country because the universities are ready and rearing to go. The political and the government, the political climate is also right, and government realizes the problem of SUD. Because South Africa was one of the countries that banned alcohol in COVID. And what we found interestingly, that once alcohol was banned, there was significant decrease in admissions to emergency rooms. There was a significant decrease in violence, in car accidents related to alcohol. But once the ban was lifted, there was an increase in all of this again. So that is a glaring example that yes, it's a problem in the country. We've conducted the walkthrough training. We've started implementing some of the modules into our universities, and ICUDDR has started providing the technical support. And yes, I think this is extremely exciting because Beatrice presented the pyramid in terms of where we are going and the framework that we're following. We're almost up to the last or the pinnacle of the pyramid and achieving our objectives for ICUDDR. I would like to acknowledge my colleagues. It was a collaborative effort, which obviously if you take any project, you need to collaborate. It cannot be done as an individual. And what we would like to see to be continued is that the need assessment can be replicated to other universities in the rest of the continent, and we can see what the needs are, and hopefully we can combine forces and provide a brilliant addiction science program in the African continent. So thank you all for listening, and that's the end of my presentation.
So nicely done. Thank you, Rehana. And we are in perfect time, and all speakers kept our original time plans, and thanks so much to all of you, because that's always stressful to me that we will have a problem. So we have no problem today, and we have very comfortable time for questions. And I listed what you sent to us, and I selected a couple of questions, and I will start with the list before oral questions. And the first question is to Beatrice. It's by Edwin, and Edwin is ISSUP member. And the question is about joining you, I mean ICUDDR, because there is a group of colleges, and the question is if colleges are acceptable as ICUDDR members. So I think that it's perfect opportunity for promoting and inviting colleagues from colleges. Beatrice, please.
Thank you, Mikal. And yes, indeed, and I can see Carrie here is saying yes. You know, she's the one that's most on the other side. So I can confidently say, like Carrie, it's a yes. Of course, we talk about universities, but we are cognizant of the fact that we have got colleges that offer curriculum which is recognized in their universities and also accredited by accrediting organizations. And I think that is really what is important. So yes, we're going to have conversations, and we welcome much more conversation after this presentation by those that are in colleges to see how we can be part of this agenda. I do know that we do have one of the colleges in Kenya called SAPTA, and many of us are familiar with Dr. Yes, he's my friend, and his name sometimes just disappears. Maybe it's age related, but SAPTA is known, Support for Addiction Prevention and Treatment in Africa. And yes, Bill, he's part of this, and we do work together in ICUDDR with that organization. So yes, Edwin, most welcome. Thank you.
Thank you, Beatrice. The second question.
I can add to that by saying, if you want to go to ICUDDR.org, and on the top there's a membership link, and it'll say join us, and you can very easily join as either a faculty member, an individual, which is a new option that we have available now, or if you're authorized to join as your university representative, wonderful, or you can do both. And it's a very simple form, and we respond back to you very quickly with letting you know that we received it, and you know that you're part of ICUDDR now.
Great, thank you, Carrie, for this additional clarification. And the second question is for Martin. Martin, it's about regulatory authorities, and if you can explain how did you deal with regulatory authorities in Nigeria, and specifically there is mentioning NUC. I don't know what specifically does it mean, but maybe you know, and maybe if you can explain how did you deal with it and with this issue, because I think that it's very general, and all of us have to deal with regulatory authorities, and it's always questionable how to avoid troubles and be successful with final accreditation and receiving permission to provide. And Martin, if you can respond to this question. Thank you.
Yes, thank you very much, Mika, and thanks for asking this question, the colleague who asked. NUC stands for the Nigeria Universities Commission. It's a regulatory body for programs at the university levels. Well, like I said in the course of my presentation, sorry, can you hear me? Can you hear me? Okay, sorry, I think there seems to be network fluctuations. So, like I said, the Nigeria University Commission, that is what the acronym NUC stands for. It's a regulatory body for academic programs in the university. I identified that as one of the challenges, you know, as far as addiction programs are concerned, or addiction program in the university is concerned, because you discover that the gaps are there because it's a new field of learning in the university. So that also comes with its own challenge. But from experience and from what is obtainable, courses would have even started, you know, before you invite accreditation bodies to come and accredit the programs. So I can also refer a colleague to the two universities that have been able to go through this in Nigeria, the Niger Delta University and Nnamdi Azikiwe University in Nigeria. So these two universities, you can also reach out to us. We'll give you a guide on how far they have gone in the accreditation process, and if there's any challenge, we will let you know. But this is all part of what we are working through, so that at the end, at least we'll have these courses, you know, well accredited and certified. Thank you.
Thank you, Martin. And the next question is for Rehana. And in fact, there are two questions. The first one is very simple. Rehana, you mentioned a response rate, and you have a really high response rate, what is usually a low point of many surveys. And do you think that it's about your highly professional, motivated work with your colleagues, or is it more about high motivation of your colleagues in South Africa? It's about your work, or about their high motivation?
I think it's a combination. You know, it's a combination of motivation from colleagues. It's the interest that's now picking up in South Africa because we did the walkthrough, and ICUDDR is becoming a very famous and familiar name in the country. But I think a lot of our work is driven by passion. And you know, when you're passionate about something, you will do everything. And I think that and relationships are so important. I can't even emphasize. And I think that was why we had such a high response rate.
Right, thank you.
Passion and relationships, like a love story.
Examples are the best, yeah. And the second question is partially to you and partially to Beatrice, because it's about scholarship. And if you can say if your universities are providing scholarships, or if some general information you can provide about this issue in South Africa or in Kenya. Martin, do you have a existing and operating program at this moment, or it's about accreditation now in Nigeria?
Sorry, Mika, if I got you right, so universities are presently running academic program.
Yeah, and
yes.
you plan providing some scholarships for applicants, or it's not option now?
No, it's fee paying. You know, the no scholarship for now.
Yeah, and Rehana, if you can respond, and then Beatrice.
Yeah, something part of our ICUDDR objective is that we need to start looking at scholarships and exchange programs. And I think if people are interested, is to join the ICUDDR, because we are advocates for this. So, you know, we want to build your capacity. So if you become an ICUDDR member and say you're interested in wanting to come to do a scholarship or a degree in South Africa, you have the South African chapter, make contact with us. We will look at what's available and we will try to make that possible. And also our postgraduate diploma in addictions is online as well. So that's also an option. But certainly that's one of the main objectives, not only of South Africa or the continent, but global ICUDDR is looking for scholarships for capacity building.
Thank you. Beatrice, do you have some scholarships, or it's not available? Oh, it looks...
Connection was lost momentarily.
Yeah, okay. We can respond later. Next question is, how many universities in Africa have started a degree program for drug addictions? Oh, I see Beatrice. Beatrice, can you hear the former question about scholarships? Is it something available in Kenya or not?
Sorry, I was kicked out by my network a little, so you may say that question one more time. Thank you.
The question is if you are providing some scholarships and if some support, some kind of support is available for applicants for Kenyatta University or other universities in Kenya, if you can say something about it.
Okay, thank you, Professor Mikal, and for the attendee that has asked that question. Really, resources are one of the biggest challenges we have in our continent. I never want to discourage us from trying, because I do know that sometimes different organizations may offer grants, and within those grants, there could be students pulled in to study. And so I encourage people to join the programs, and faculty also works really hard in writing grant proposals. And perhaps one of the areas that we can benefit a lot is from some of the partners in this call, throwing in research grants, and as part of those research grants, having students included. And so, for example, I do know in our university, some of our master's students, not necessarily for the addiction program, have benefited from partial scholarships for their research projects through grants that have been awarded by organizations. For example, our National Authority for the Campaign Against Drug Abuse may once in a while throw in a grant for a project that is in the area of addiction studies. And therefore, what I encourage our attendees and those that are interested is please join in, mobilize your resources and begin programs. And in the process, as you partner with your faculty, then you can become part of projects that could have a component of sponsorship for students within that grant. Thank you.
Thank you, Beatrice. I see many expressing thanks to all of you. To our speakers. And the next question is by Dixon about how many universities in Africa have started a degree program for drug addictions. So maybe I can start and ask you if you have more recent information, because the last analysis what was published was what I mentioned before in 2020 in Journal of Substance Use, where we analyzed all available programs, what we were able to found. And what is good to know is that some of these programs are not degree programs, in fact, and they are some kind of different training and supportive programs. And some programs already exist, degree programs, and maybe Beatrice or Rehanna or Martin have a more recent information if there is increasing number of African programs than we found before in 2020, if you have something new.
Thank you, Mikhail, for that.
Yep.
Thank you, and thank you for that question to our participant. Indeed, that data by Professor Mikhail that he just mentioned in the Journal of Substance Use is the most current, authentic that we have for Africa. But we also acknowledge that many more institutions, if you remember, we have the steps that I showed in the model. So many more universities are on course towards developing programs, but they are somewhere along that staircase that you saw, that hierarchy. So some are at the level of doing needs assessment, like you have heard about South African universities. Others are at the level of doing the walkthroughs in partnership with ISSUP and Colombo Plan DAP. Others are actually at the level, for example, recently we got a communication from Ethiopia. They are interested in, they are trying to put together the faculty that we can capacity build for purposes of moving towards developing programs. So I do think in the next 3 years or so, we are going to begin to see programs, which is basically the outcome of all these activities that we are currently engaging in. I do know that North Africa, and I hope Dr. Rania is probably on the call, and if she's not, she's part of this team, one of our regional coordinators for North Africa. They're very keen on developing what they're calling an integrated program, which will be offered by several universities in Northern Africa, rather than a program for a single university. So we are encouraging a lot of collaborations. And so for now, the data we have is what Professor Mikhail mentioned. I can also request Rehanna and Martin if they have something else to add. Thank you.
So I think just to reiterate, Beatrice, it's like what Professor Mikhail's paper is still the latest and it stands as is. So in South Africa, we have 2 universities that offer a postgraduate diploma in addictions, but also a master's in addiction, and you can specialize with a PhD in addictions as a course. So currently, that's where we are at.
Thank you, Beatrice and Rehanna. I think the addition that becoming the 2 universities approved in Nigeria, or that already running addition programs in Nigeria. I remember very well. I think that paper was published in 2020. You may correct me if I'm wrong, and these programs were approved 2021. So it may be the 2 additional programs to the one as earlier published. Subsequent publications may update to reflect this or include these two universities. Thank you.
Thank you to all of
Thank
you.
you, Professor Mikal. Allow me to add one more point that one of the things we have discovered in several of our countries is that we want to target both professionals already in the field, and we also want to target those that would intend to get into the field. And that is why the model of starting a postgraduate diploma is helpful. In my own country and in my own university in Kenyatta, we actually have a postgraduate diploma in addiction treatment science. And it was informed by the realization that many of the people that have an interest in this program already have their own paths of career development. For example, they're already pursuing masters in psychiatry. They're already pursuing masters and PhD in counseling psychology, in social work. And we realized that addiction science is a multidisciplinary kind of field. And therefore, we do not want to limit ourselves to or keep away, deny access to people that are actually in the practice and working with these clients, but they've already chosen their paths of career development. So that is why sometimes offering it as a postgraduate diploma does serve the purpose of giving a specialization, line for those who already have other specializations that they have taken. Thank you.
Thank you, Beatrice. And I have a question probably to all of you, because there are many comments and very interesting comments regarding real programs, I mean service providers, and imbalance situation on the scene of service providers in terms of, for instance, lack of medical-oriented programs and some other imbalances in the system. And the question is, if you can see in your countries, and despite the fact that many of these study programs on universities are really young, very new, and you have a very little number of years of real existence, but if you can see some first impact on the real world of service providers, and if you can see some positive impact on number of service providers or scale of service providers in terms of more making the system more balanced, can you say something about it from your perspective in your countries? What do you think about it, and if you can witnessing some positive impact of your work?
Thank you very much, and I kind of feel excited when I hear that question, because we have got a set of graduates from a pioneer class that was affected by COVID, and we have a one-year program. It's an intensive one-year program of 3 semesters, and 2 semesters are coursework, and the 3rd semester is actually project and practicum. And in the practicum, the students get attached in the actual sites where the work is going on, where the clients are found. And what we found is that the very first bunch of students we sent out for practicum, they made such a tremendous impact that they were given responsibilities that we did not anticipate. I remember one of them, who's a psychiatrist, writing me this big message and saying that she made a talk in her psychiatry, orientation meeting. She gave a vote of thanks, and in the process, she mentioned some of the concepts she had learned in our courses, and she was given an appointment the next Monday to be given a job. And she says that every time her boss keeps saying, if you want to ask any question about addiction, talk to this lady. So she graduated last year, and I happened to meet her spouse, and the spouse told me that the wife says that this is the life-changing course that she ever did. She had done a bachelor's in medicine, a master's in psychiatry, and she did this postgraduate diploma. And that is what I have had. But I want to say that we're in the process of doing a formal impact assessment. And I know in our last webinar of Africa, we did speak with a colleague from South Africa who is also trying to do a needs assessment of their program. And so in the next couple of months, we should be able to have concrete evidence that we can probably publish and talk about in a forum like this about the impact and document the stories and the messages of the employers of these graduates, as well as the graduates themselves. Thank you.
Thank you, Beatrice. Rehana, can you proceed?
Yes, so I know time is running out. So very quickly to say that we are also doing currently an impact study from the very first year that students started with the PGDIP right until now. It's one of the students' master's thesis project, and it's quite interesting because she will be presenting at the ICUDDR conference in Chiang Mai, where we will actually see the evidence base in terms of what was the impact of the PGDIP that we have established. So yeah, so maybe we could have a webinar on that in terms of what's been the impact of what we've been doing.
Yeah, sure, we have to. Martin, would you like to add anything to this question? I know.
Thank you very much. Yes, thank you very much, Mika. I think Rihanna and Beatrice have provided insight to that. From a Nigeria perspective, being that we are still at the early stage of addiction programs in the university, so we have not produced graduates yet for such evaluation, but we also want to believe that it's a very important aspect that we need to follow up so that we know how much of impact our products are making in the society. Thank you.
Thank you, Martin. And I received very interesting question, and it's again to all of you. It's about profiling your graduates, profiling your study programs, and if you can say something about it, because it is about it's about preliminary idea, it's about need assessment. Rehana spoke about it. What kind of profile can be interested? What can be the best profile for people graduated from this program for labor market, in real labor market? And if you can say something, why you choose what you mixed for your curricula, and what is your experience in terms of profiling your study program, and why you are not, or if you are mixing prevention together with treatment, with recovery, or if you are only mixing treatment or recovery, if you have something about harm reduction and focus on harm reduction, if you can say something in it, and from your kitchen, from your team, how do you think about it, and what did you do with this issue? How did you deal with it? Who will start? Maybe Martin is under process now, and he has a big group of people working on many things.
Mika, thank you for prompting me thank you for prompting me to speak, and I have to more or less adjust my seat very well because it is really a very tough one. But what I have come to realize in this field of addiction is that as a multidisciplinary field, it has a way of bringing learnings from different professions together. So in other words, you have some from medicine, some from psychology, some from social sciences, and at the end, you just discover that even though you're not a graduate of medicine or a graduate of psychology, you would have gained a reasonable level of understanding in these different professions or fields, to the extent of being able to manage persons with substance use disorders, even providing prevention intervention. So as multidisciplinary as it is bringing all of these core professions together, especially looking at the course content like we propose in our curriculum. So it has a way of cutting across the different fields, and that is a very strong advantage. Thank you.
Thank you, Martin. Beatrice?
Thank you very much for that very well thought out question, participant. And I think this is a very critical thing to think about when you develop a program. And that's why needs assessment is a critical step. So in the needs assessment, part of the target respondents is basically the market players. And the market players would tell you, what are we seeing? What are we lacking? And I'm going to give an example of my own university program that we developed. So over the years, we had students from counseling psychology going for practicum, They were either at master's or PhD or even bachelor's, and they would be placed in addiction treatment centers. And we had a tool where we got feedback from the market to tell us, what is our product like? What are the strengths of this student? What are the weak areas? What would you like us to strengthen? And we would then analyze this data and consistently kept telling us our students were not doing well with assessment. They were not doing well with multidisciplinary, work with other professionals, because they were trained strictly in a limited field of counseling psychology. And so that data was very useful in feeding into our program development for addiction science. At the same time, when we did a needs assessment at that point, we also got additional skills, additional competencies and needs. And so based on this, our program basically cuts across the basic UTC. We adapted the UTC basic. We also brought in a bit of the advanced courses, and we also brought in a bit of the recovery support. Why? Because of the needs that came out of the needs assessment. And therefore, we have got courses on the science of addiction. We have got courses on assessment, the continuum of care. We have courses on family involvement. And then, of course, we then adapted to our local context. And we knew that for our university, a postgraduate student must have skills in research. So we brought in a research course. However, we didn't call it research, actually. We call it measurement in addiction science, because we want our students not just do any research, want them to implement some interventions in addiction practice and see how it works out and document. Then they begin to see the value of evidence base. And then we have got a practicum. And I should finally say, we also brought in a project, which is a requirement of our university. And I should announce here that in the last 1 year, we got a grant from ICUDDR and International ISSUP. I'm trying to remember what that stands for, the ISSUP. And we were able to develop a course called Publishing Addiction Science. And we want to be able to have these students in this program not only learn how to develop an intervention, implement and measure impact, but also write a project and publish some work out of it. And I'm happy to announce that the current class we have now, in the next semester, they will actually be doing the Publishing Addiction Science class. And so we are really needs driven, and we are constantly listening to the market players and our students' feedback to be able to expand our graduate profile. Thank you.
Thank you, Beatrice. And Rehana, if you are with us, if you can respond to the question, and it will be the last response. Oh, we probably lost connection with Rehana. So I see that we used the time, and we are 3 minutes left. So thanks so much to all of you, Rehana, Beatrice, Martin. It was very nice to see you again and hear you and look at your presentation. Very nice presentation, and thanks so much for your excellent work, what you did and what you do for your countries, for your continent, and for ICUDDR, and thanks so much again. And I would like to also express my thanks again to Kerry Hopkins, Radolf Nordway, and Olivia Woodrow for supporting us and making backup for us. And of course, last but not least, I would like to express my special thanks also towards RNL for sponsoring, and your governments, our governments, for sponsoring our work and allowed us to do what we think that we should to do. So thank you very much for attending today's webinar, and hopefully it was useful and fruitful to all of you. And I thought that we have approximately 300 participants today, and that's pretty nice. And I am still really happy that we can be together. And have a nice day. Take care, and see you next time on some other webinar or conference organized by ICUDDR or ISSUP. Thank you very much, and see you.
Thank you, Mika. Thank you, Beatrice and Johanna. Bye. Yeah.
Bye.